Hello, I'm Chris Campbell.
And I'm Blake Benberry, and we welcome you to 15 News. You know, Chris, healthcare has very much been a hot button topic.
Definitely. I can't tell you how many stories I've seen about it, from healthcare reform to fitness and lifestyle, all over the news.
Well, a local faith-based institution held a community-wide expo that looked to share healthcare information with local residents. Let's check it out. Southfield's New Hope Missionary Baptist Church held its 6th Annual Health Expo. The event featured free flu shots, blood pressure screening, stroke risk assessment, and body mass indexing.
This is a community outreach event so that the church can provide free medical services and also health education to the local community.
I'm part of the screeners. We're screening for blood pressure, high cholesterol, and high blood sugar as part of a community outreach program. Our process for drawing blood today is actually not a full blood draw like you would do in a doctor's office. We take a small sample of blood from a finger poke, and then we use that blood to screen for high blood sugar or high cholesterol. And we actually have monitors right here with us that'll tell us almost immediately what your blood sugar number is and what your cholesterol is, so we can give you some recommendations right here.
I was sent here by Sinai Grace Hospital to interact with this community. What I'm doing at my table is going over certain stroke risk factors with the members of this community, trying to assess their individual risk for stroke and seeing and giving them advice about what things they could do to reduce their stroke risk. I'm also going over some stroke risk factors and signs and symptoms of stroke so that they can recognize strokes easier.
There was a fitness component to the event as former The Scene dancer Fast Freddy conducted healthy hustle classes, and the church spotlighted its local dance troupe.
My role was just dancing, fun, and exercise. Show people how much fun you can have dancing and show how easy it really is that we can come together and do some things with a small bit of direction. Line dancing is very popular now. It's something that everybody can be involved in. So I do a little line dance thing, a little two-step here, a little two-step there. I try to make it simple and fun. Then ballroom dancing is very popular, but everybody's not fortunate enough to have a partner. So I show you how to do it with a partner and without a partner. So when you can have fun and exercise, it doesn't seem like exercise, but you're having fun. It's a twofold thing.
We do encourage exercise. Even though we are a liturgical dance troupe, I do encourage stretching, I encourage exercise, I encourage them to eat well, because our body is a temple of the Lord. So diet and exercise is all a part of that.
The highlight of the day was the keynote address given by Dr. Monique Butler of DMC's Sinai Grace Hospital, who spoke on healthcare prevention and the Affordable Health Care Act.
The title of my presentation was Time for a Change, Our New Healthcare Reform, where we talked a lot about some of the different things that we can do to make ourselves healthier. We talked about the fact that with the Affordable Care Act and Obamacare, patient responsibility is paramount. So we have to make sure that we're doing what we need to do to live healthier lives and to make better decisions. So I shared that with the audience today.
Medical professionals who were on staff gave special effort to sharing information about common signs, symptoms, and risk factors for stroke prevention.
Stroke is the leading cause of disability in the United States. It's the 4th leading cause of death. We have treatments now that we can offer stroke patients if they recognize signs and symptoms early and bring their loved ones or arrive at the hospital in a timely manner, and patients need to know that. African Americans are at a higher risk of stroke than their Caucasian counterparts, and so it's very important that they should know their risk factors, their individual risk factors, be aware of them, and take steps to reduce their risk. The common risk factors for stroke are high blood pressure, high cholesterol, diabetes, cigarette smoking. The elderly sometimes have an irregular heartbeat called atrial fibrillation. Having a family member who has had a stroke also increases your risk. A sedentary lifestyle, being overweight, these are all common risk factors that we see in our population.
At the end of the day, the dominant theme was that health is wealth, and by applying the information shared, attendees would greatly increase their quality of life.
I feel very happy to see that, and very heartened to see people taking more interest in giving their health and their stroke risk factors a priority. Learning about their risk factors and asking their burning questions that often they cannot bring up at a doctor's office, and feel more comfortable talking in these circumstances or in these events.
You know, expos like these in the community are our way to screen the general population and find problems that people don't necessarily know they even had, so we can get them in to see a doctor and start modifying these risk factors before somebody would develop a serious complication like a heart attack or a stroke. So these expos and fairs are tremendously important for our community.
When we start to exercise, the heart rate goes up, so we're starting to move more oxygen-rich blood throughout the body, which helps to feed the different organs that we talked about. And the way that we do that is through the blood vessels. The heart rate goes up, what we call the cardiac output, so the amount of blood that the heart puts out goes up. So basically what we're doing is we're training the heart along with the blood vessels, the brain and the other tissues of the importance of expelling energy. So many of us talk about fitness. When we talk about fitness, we talk about nutrition and exercise. Many people don't want to hear that, but I'm here to say that there's not one magic pill. Lifestyle changes are the key, and behavior modification, both of those together, are the key to living a healthy lifestyle.
To learn more about various DMC-related health events, visit dmc.org.